to stay connected to our 1,300 that are in our network and readership for Women Mean Business, and to provide the support and wonderful presenters that we've had since last March. So we are grateful for your time and interest in being online with us this morning. We thank you. And just some housekeeping notes, please keep your mics on mute. By all means, do utilize the chat room for any questions. We'll have a Q&A afterwards. And now we'll just going to have Josie introduce Dr. Sarah Wilson. Josie?
Thank you so much, Gabby. And it is my pleasure to introduce this very dynamic, wonderful lady, Dr. Sarah Wilson, ND, and a little bit about her. She is a passionate researcher, author, educator, mom, business owner, and naturopathic doctor. Sarah is driven by her passion to change the landscape of healthcare for women. Sarah can be found teaching other healthcare practitioners and working with her team to enhance health of those around her. After struggling for many years with her own health issues, Sarah decided to take her research skills and finally come to understand how these undiagnosable symptoms were related. In the process of changing her own health, Sarah realized how many other women were struggling with fatigue and hormonal havoc, digestive issues, inflammatory issues, fertility concerns, and so much more. This is the basis of her now thriving medical practice here in Kingston, Advanced Women's Health. Sarah's passion is to educate and empower her patients. And this is why she's here today. So everyone, please, a warm welcome to Sarah. Thank you.
Thank you. Thank you so much, everyone. I know the muted claps. This is how we do life now. Okay, perfect. I will share my screen. Thank you so much, everyone, for coming and having me. It is always my pleasure to speak to people. I think specifically women in business, because we affect so many others around us, and we are a leader in our homes, we're a leader in our businesses, we're a leader in so many different ways. And from my perspective, one of the reasons I love working with women is I know that when I affect change in one person, it trickles down to everyone else. And so you really can affect the masses that way. And it's really what drives me fundamentally. So I'm so excited to be here. Thank you. And today we're going to talk about what I lovingly call busy women angry hormones, because so many of us have had that question of, okay, can I do what I want to do? Can I hustle and drive forward and achieve the things I want to achieve, all while having my health intact? Because oftentimes in women's lives, it feels like a choice, right? Men too, but in women's lives, it's like, do I have a child? Do I put my career on pause? Because you can do all of it, but there's a balance. And then when you're going through perimenopause, it can be a little bit of a roller coaster. It can be a little bit crazy. And so from that standpoint, it's like, okay, how do I deal with the fatigue and the brain fog and the anxiety, all while showing up and being the best that I can? And you can do both, which is why I'm so passionate about it. But foundationally, we have to have support when we do that. So that's the big question, right? Can I have it all? Can I do it all? How does this all work? And right now, the reason why this topic I think is so important is because we are more than we've ever had to be, right? Now we are leading teams online, which requires a different level of energy. We have to, if you have children at home, you have to teach those children. You have to do extra things to reach out and get that community. Plus, you're still a partner and navigating that, because so few people have been 24/7 with their partners in a really long time, and figuring out that balance can be challenging. And it just goes on and on and on. And I think in the midst of a pandemic, obviously it's an important conversation, but even outside of that, really, we are of the first generations to be told that we can have it all, that we can do it all. But we are also, it was funny, I was listening to a talk on the weekend and I thought they said it really, really well. What we're not taught is that we have to ask for help in a different way, and that we can't show up and be perfect and also be driving our businesses forward and taking care of the dishes and doing the laundry and all of the things together. So there's a whole different role. And I think we really need to ask for help, and we need to get help at home and in business and all of these things, which we're just not taught to be good at. And so, like I said, when when we're pulled in a million different directions, we really, really need to take proactive steps in our health. And there's two different models of healthcare, and both of them are brilliant. There's a disease-based model of healthcare, which says like, okay, you have a disease and now we can do something about it. And then there's a proactive model of healthcare, which essentially says, amazing, this is what we're looking at. This is a health-based model. So how can we get you feeling the best you possibly can with everything you have access to? And that's really what I'm passionate about, is that proactive model of saying, okay, let's look at where you are. Let's see how you can be better without having to wait until we get to a disease. So everyone's, I know, on mute here, but I can only imagine there's going to be hands raised when we talk about some of these symptoms. And I lovingly call this the itty bitty shitty committee, because it's all of these symptoms in all different areas, but nothing is big enough that you've either known how to ask for help for it or been able to access care. Because again, there's a lot of models of healthcare that want to make you the best they can, but they don't function on a proactive approach. So if you don't have a disease, they don't really have a lot of options for you. And so these are the signs of the angry hormones. So we're looking at exhaustion. So that can be, you wake up in the morning and you're like, okay, did I sleep last night? Like, what happened here? I'm so tired, and really struggling to push through your day. And then oftentimes I also find that you can kind of wake up and be exhausted in the morning, and then you get in towards the evening and you're just exhausted, but wired. It's like that too much coffee energy where you're like, all of a sudden it's 7, 8 p.m. and you're trying to wind down, and now you have energy to clean the whole house and do this and do that. And then you can't get to sleep. There's also a big piece of mood changes. And so research has shown, and I think this is a very empowering thing, but research has shown over the years that anxiety, depression, a lot of conditions associated with mental health are actually based in inflammation. So typically we've thought of them as serotonin or dopamine, or these what they're called neurotransmitters. There's chemical signals in the brain that are controlling them, which is where antidepressant medications come in. But again, research is driven down over and over again that without inflammation, you cannot have these conditions. And so if you are also experiencing other things that we'll get into, like digestive issues and joint aches and pains, then oftentimes the mental, emotional things that we see in terms of mild anxiety, depression, apathy, irritability can trace back to inflammation, which is interesting because that's something that can be changed so quickly. There's also the irritability piece that comes in. I can't tell you how many times I have talked to people that they're like, my fuse is like this. It's just like this right now. I just trip off and I can't handle any extra on my plate. And I often say that's the bucket full. So I love the bucket analogy that we can only handle so many pieces of the puzzle. And then once your bucket is full, all it takes is the hair on the counter or the dish not being taken out of the sink and put in the dishwasher for you to be triggered and just flip. And that switch flipping is a sign that your bucket is full and we need to do a lot to empty it. And that's what we're going to get into today. Constant feelings of overwhelm, we just talked about that. Issues with sleep is huge, because if your body thinks it's running from a bear, which we're going to get into the nitty gritty of how the stress response works, but if your body constantly thinks it's running from a bear, then you're going to not want to just pull over and go to sleep. It's like, oh yeah, no, it's good. I'm just going to have a nap. It's fine. Not the case in these situations with the stress response being active. Then we see things like PMS, acne, period changes, pain with your periods. When you're getting into that kind of perimenopausal window, we see hot flashes and night sweats and things that are really triggered by stress. Hair loss can also be involved. Low libido can also be involved. And this is something I talk to a lot of my patients about, is they're like, oh, isn't it just normal? Like, who has time? It's fine, right? No, we don't want to be living in that world. Tons of cravings, weight changes. Oftentimes people are coming to me, not necessarily with the precipitous weight loss, but they've changed nothing else, like nothing. Exercise is the same, diet is the same, and they're gaining weight. And they're like, what the heck? This is so frustrating. And that's because I always say weight loss and weight gain are about hormones. It's not at all about calories. And so that's a big thing that we often unpack in my office. aches and pains, brain fog and memory challenges. We see digestive issues, yeast infections, which no one wants to talk about, but it's really an important piece of our health. And then poor immune function. So it's interesting because I also hear 24/7. People are like, I'm never sick. I'm so strong. It's perfect. I'm good. I'm never sick. But that's actually not a good thing. The signs of you getting sick is the signs of your immune system working, right? Aches and pains, fever, the like cold and flu symptoms. That's the signs of your immune system working. So if your immune system's never working and everyone else in your house is sick, don't you think that's an issue, right? Like the fact that your immune system can't mount a response is actually not a positive thing. So we should be sick once to twice a year, not more than that, but also going 3-5 years without any kind of immune system response is not a good sign. And we'll get into why that is. Okay. So the solution is just retire, leave your life, meditate on a mountain. We're good, right? Like we don't need to do any of this. You just walk away from it all and it will all be fine. But obviously that's not working in the context of our day-to-day lives. So my big thing whenever we are talking about the different stress responses is to really unpack what stress is. Because when we think of stress, we think of just mental emotional stress. Your emails dinging, you think of the 20 million things that you have to do on your to-do list, you think of a fight with your partner, right? You think of all of these things when it comes to stress. But there's so many stresses that are filling your bucket without even knowing. So again, that bucket analogy of you can only layer in so many things before it overflows. And so if we can deal with the stresses that we can control, then we can handle the stressors that we can't. This is part of why so many women come into me and they hit 40 and they're like, oh, it's all downhill. It's already started. It's downhill. And it's like, no, that doesn't have to be the case. I've had 21-year-old patients who are told they're aging, which is obviously bull. And so it's not about the aging process. It's about how many of these stressors are in place, because your body is such an ancestral basis in terms of the concept of the stress response that we don't know the difference between literally running from a bear and sitting in our own bodies with blood sugar imbalances. So the big stressors in the big categories that we can control and can really take action on sit in the categories of inflammation. And so inflammation, this is going to show up as things like aches and pains, and oftentimes is going to relate to can be autoimmune conditions, right? It can be conditions in our body that cause issues, but it can also be related back to gut bug issues, right? It can be related to the bloating and the gas and the digestive issues that you're having. It's a big connection there, point in terms of your gut and your brain and inflammation. Infections is another huge one. So yes, obviously now we're in the middle of talking about viral infections, but if you have ever had mono, it's actually never left your body. And most of us have had mono. I have been lucky enough to have mono reactivate 3 times in my body. It's possible. We also look at things like shingles, right? So oftentimes if you ever have anyone around you who's had shingles, they're like, oh yeah, I was really stressed. And then boom, my shingles came up. That is an infection, but that's also going to cause a big stress on your body because, again, your body doesn't know that it can't die from shingles. And so we mount a really strong stress response. Then we look at hormonal imbalance. And so from a hormonal imbalance perspective, we are really apt to see these changes in the stress response with hormones, both cause and effect, which we'll get into. And because of that, when we see, for example, if you are still having a cycle right before your period, there's really significant hormone changes that happen. So we should have estrogen and progesterone, which is a really calming hormone, in even levels. And so with that, if they are imbalanced, then your body is going to have a change in going back to inflammation, which can trigger a stress response. And then during perimenopause, it's just a show. Your hormones are all over the place. They are bouncing around, which is why so many people have symptoms. But that's going to trigger the stress response, which is also why when you're stressed out, you're going to have worse symptoms. Like I'll have patients who their hot flashes, night sweats, everything's gone. So we've done the treatments, everything's gone. And then they book back in and they're like, it's back. I'm like, what happened? They're like, nothing. I'm not stressed. I feel great. The only time it shows up is in a boardroom. I'm like, I wonder why, right? Because your body has activated that stress response. And then when after you go through menopause, what happens is your ovaries, which are the reproductive organs that normally make the majority of your hormones when you're menstruating, they become inactive. And then now we rely on this little tiny gland called our adrenal gland to make both estrogen, progesterone, testosterone, so all of our sex hormones, and cortisol. So then there is a bit of a choice that occurs in terms of how our brain talks to our adrenal glands and deciding, okay, which hormones are going to be produced. And that's where hormonal imbalances come up as well. Then we have gut health. We talked about that a little bit, but we are actually, I used to do a lot of different research, but one of my jobs was a probiotic researcher, and we are more bugs than we are human cells. And so from that standpoint, if you think that the mess that is happening in your gastrointestinal tract or the rashes on your body or skin issues, like I said, all these things outside of digestive issues, if you think they're unrelated to your stress response, then you are kidding yourself. So it really has a significant impact. Then we look at blood sugar imbalances. And so blood sugar imbalance, I think, is the foundation of the triangle. When you are trying to establish good health, if your blood sugar is going high and then low with every meal that you eat, you're in a stress response at both periods of time. So you're going to feel hangry and all kinds of things, but it's also a massive, massive stress response. Then we look at nutrient deficiencies. So this is the easiest one to take away, right? If you've ever been told you're anemic, if you have been told you have low B12, if your vitamin D has not been tested, and we live in Canada, which even the UK, they're worse than us, to be honest, because they don't have sun. But vitamin D is so critical to hormonal balance, to inflammatory response. We're always told, oh, take it for your bone health. But vitamin D controls almost every system of the body. And one of the most important ones is inflammation. So everyone should be knowing what their vitamin D level is and supplementing to get to an adequate level. And then after we do all of those things, that's when we look at mental and emotional health. Right? So when I say the word stress, so many people get triggered and they're like, I'm doing everything I can to manage my stress. Like they're like, it's stressful to me for you to tell me to manage my stress. And I get it, which is why we deal with everything else on that wheel before we even have any discussions about the mental emotional piece, because it's so foundational. Okay. So now we get into the nerdy part. So you guys just have to work with me for 1 second because all of me loves the nerd. So stress response 101, what is happening in our body? And again, like raise of hands, how many of you guys have heard of cortisol? Cortisol. Okay. Yeah. So cortisol is one area of the response. Perfect. Lots of hands raising here, which is awesome. And what we hear about all the time is adrenal fatigue, right? You have adrenal fatigue and your cortisol is out of whack. And I could get into that for a million years. Your adrenals know what to do. Your brain's just not telling them to do it. Or there's an area of your body, it's called the mitochondria, again, dirty, nerdy here, but that's not working. Your adrenals know what to do, but cortisol is such a small part of the stress response. Like when you are walking down an alley, for example, and you see someone coming towards you and it's dark and you get that like heebie-jeebie feeling and your heart starts to race and you're like, okay, what's happening? That's not cortisol. So if you're sitting in a meeting and someone says something to you and you get this rush of a stress response and you're like, okay, my heart's beating, I'm sweating a little bit, that has nothing to do with cortisol. That has everything to do with epinephrine and norepinephrine, which is a different arm of our stress response. And so I find so often, if any of you guys have worked with a holistic practitioner or even tried on your own these adrenal herbs and nothing's worked for you, it's because we actually have to start higher up on the system. So this picture here we can see the stress response in action. So here we have parasympathetic and sympathetic, right? So we hear rest and digest and fight or flight. So fight or flight is like run from the bear, and rest and digest is everything calms down and everything kind of relaxes. And this is the first response that we have in our body, is that fight or flight or rest and digest. 20 to 30 minutes later, we have a cortisol issue. So that's why if you're constantly stressed, you're not going to pull on this axis the whole time. You are going to start to use cortisol, which we'll get into next. But just differentiating those things and knowing what you're feeling in your body and being like, interesting, that's not cortisol. Therefore, I need to go about this differently. If you're getting those spikes of anxiety throughout the day, these are things we can manage. But what we can see here is when we go into that sympathetic fight or flight response, what actually happens is blood leaves the core of your body and goes out to our limbs so that we can run. So that's why you can feel nauseous. That's why your meal can sit really heavy on your stomach. That's why some people, their body evacuates, literally, right? Because it wants to be less heavy so that it can get away from the bear. And two, because it actually doesn't have any of the resources or blood flow it needs to digest food. And so then you can see that you are going to get your airways opening and your heart rate's going, and you get this stimulation of cortisol to come in later. But it goes to explain why some of those symptoms come in terms of your stomach hurts and you're not feeling good and your heart's beating, and that's all a hormonal response. And then we get in here and look at, okay, so now what's going to happen? So we get the epinephrine response, which we just talked about, but then we also are going to start to get that cortisol response. And cortisol causes your blood sugar to go up. And this, I think, is so important to keep in mind, because when we're looking at, let's say, weight regulation as a challenge, if your body's blood sugar goes up because of the stress response, because your body is thinking it's going to run from a bear, it's not knowing that it's sitting in traffic, right? That blood sugar goes up and that it has to go somewhere. You're not using it. And so your body wants to store that in your fat cells. So I always like to say none of these things are an accident, but I hear them all the time where people are like, I don't understand. Like, I have changed nothing, but still my hormones are not balanced. I'm exhausted all the time. Then I feel wired and anxious, and my digestion is a mess. And it goes back to these primitive systems, which is why I really like to show you guys how the nervous system and the stress response works. Because when you understand it and you can see it in yourself, then you can affect change and be like, oh, okay, perfect. I saw that stress response. I can do deep breathing or whatever's going to work for you. You know, you're walking into a stressful event. We'll talk about some herbal teas that are amazing just to calm that down. And then you can break all of these cycles, because it really does come down to a cycle. We get into this kind of constant stress, then we get the hormonal havoc, the blood sugar dysregulation, which we've talked about, which is going to cause inflammation and gut issues. And then wham, bam, thank you, ma'am, you're stuck in a loop and you're like, where do I go from here? Right? How do I unpack this on my own? And just like cycles that are perpetuating and winding up, we have to intersect it. So you have to figure out what's your biggest challenge. Is it blood sugar regulation, hormonal havoc, or inflammation? And then you intersect on that issue and you're going to be able to affect change. So again, just taking an herb for the stress response is not intersecting on any of these axes. And so you need to pick which one is most appropriate before you dive in. And I will show you how to do that. Okay. So signs start with blood sugar regulation. I think everyone needs to start with blood sugar regulation, to be completely honest. It's a huge, huge piece. But when we're looking at blood sugar regulation concerns, we're looking at sugar cravings, right? And specifically those nighttime sugar cravings that you feel like you just cannot get away from. That's a really big sign that there's a stress-induced sugar cravings. How many of you guys have experienced hangry? No hangry people here. My goodness, I am shocked, because pretty much, it's funny because I'll ask people now, and we will have partners pop their heads in the background because it's all online, and I'll be like, "Oh, how's your PMS?" And they're like, "It's fine." And they're like, and I'm like, "Oh, how are you feeling? Do you get hangry with meals? Do you get tired with meals?" And they're like, "No, I'm fine." And their partners are like, So it's always my joy to do group consults now without people knowing it, because their partners are involved. We can also see midday anxiety is a very specific one. So if you're getting anxiety between that kind of 1 to 3 o'clock and you feel like you don't know why, that can definitely be related to your blood sugar. Brain fog is a big one. Poor concentration, especially during that window of time when you're like, oh my God, I'm going to go to sleep. The 10:30, no, if you're tired now, that's different. But from that standpoint, this is something to look at there. Weight loss resistance is a big piece. So again, we've talked about that. And it is a big part of what I talk about because it means nothing about weight. If your body's not doing what it should do, it's telling me about physiology. The number on the scale means absolutely nothing about you. And we all know that. But from that standpoint, when your body's doing something that doesn't make sense to me as a clinician, I'm like, that's really interesting. Let's unpack that. And then other things like adult acne is something that we're seeing so much of right now, and it's directly related to blood sugar imbalances, premature aging of the skin tag formation, even like if you're getting a lot of moles, a lot of like just skin changes in general, it relates back to the hormone that controls blood sugar, which is called insulin. And it's something we really should be on top of because a lot of research suggests that these changes sure are inconvenient, but Alzheimer's and dementia are being called diabetes type 3. So they're directly related to blood sugar imbalance, which is so important that we get on top of early and often. And then signs to look at hormonal dysfunction, because I always say the time to make a baby, which is the only purpose of our hormones, is not when we are stressed and running from a bear. So your brain actually changes the way it perceives your hormones use in the face of that constant stress response. So before, again, we talked about this, right? Before when you are consistently cycling, it can turn off ovulation. It can create regularity changes. And then during perimenopause and a stressful month, you could have a 50-day cycle or 20-day cycle, and that can really alter things. And then in menopause, that's where we see that fight between cortisol and we see those sex hormones. And so we really destabilize, and that's where symptoms come up. But like I said, cyclicity and mood changes. So if you're getting, even I have patients who've gone through menopause who still feel like they get mood changes cyclically. And they're like, oh, here, I'm in my days. That's something that can come up. Worsening PMS. Hair loss is a big one. So we can see when male sex hormones and female sex hormones change, we can see really significant hair loss. Insomnia is a big one. I don't know how many of you guys have experienced this, but that 2 to 4 a.m. waking, when you're awake and you're like, well, hello, to-do list. Okay. And you're just like all of a sudden racing through, and it takes 45 minutes to an hour and a half to fall back to sleep. And by that time, you're often up watching TV and getting blue light in your eyes and you can't fall back to sleep. But that specifically goes back to the hormones of cortisol and blood sugar regulation and hormone relationships together. So that 2 to 4 a.m. waking is, to me, a sign that you're in the middle of this itty bitty shitty cycle that we need to break and get out of. And the nice thing is it can turn off really, really quickly. And then, like I said, libido changes is a big one. Having no libido at any point in your life is not normal. It's a sign that there's something going on. Okay. And then the inflammation piece of the puzzle. So when to start with inflammation. And that's oftentimes when we are going back to the digestive system because of how closely those things are related. So constant bloating, it is not normal. So many people think it's normal. It is not normal to wake up in the morning and have clothes that fit. And then by the end of the day, have them be tight and uncomfortable and you're gassy and not feeling, that's not normal. That is a sign, like bacteria, when they metabolize and eat our food, right? Because we're all sharing. When that happens, they poop gas. And so from that standpoint, it's just a sign of bacterial dysregulation. And we see it more now than we ever have before. The microbiome is one of the most hotly researched areas of the body because it literally, like I said, we are more bugs than we are human cells. And so if they have that much of an impact on us and how we function and our hormones and our inflammation, then they're going to be the thing that we need to treat. And so oftentimes I'll have a patient who comes in and they're like, okay, these are my symptoms, blah, 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 blah. I'm like, this is what your bugs are telling me. They're like, I don't want you to treat my bugs. I want you to treat me. And I'm like, you are your bugs. Like, I have to kill things. I have to blow things up in there in order to get you feeling better. So it's a concept that is newer in terms of being discussed in common places. But years back, this was the foundation of my research, is how these things go together. So it's so huge. Bowel changes is another thing. Look at your poop. We are all grown adults. It is so funny how often I'll ask someone and they're like, oh my God, did you not look? No. But when you have children or pets, you're like 24/7 in their poo. You're like, oh, there's mucus. What does that mean? It's green. What does that mean? Whereas we're all like flush and rush. Get out the door. Do not pretend that did not happen. Women do not poo. And I'm like, no, guys, like it is really important because like I said, if you ever have mucus in your stool, and this is a really good gut indicator, if you have mucus in your stool, just like with a cold or a flu, your nose runs, right? Your nose is running to get those bugs out, bacteria, viruses, etc. So if your bowel is literally trying to evacuate things, then you have a significant issue that needs to be addressed. So these are all just check. I'm not getting anyone to raise their hand on that. Don't worry. I can see everyone in the background going like, no, please do not. So that's a big thing to look for. Other things, if you eat a salad and see a salad in your poop, then you're not digesting your food. And if you're not digesting your food, then that is a huge opportunity for an issue. And so when we go back to that stress response picture saying, okay, blood flow leaves the inside of your body and goes out to your arms and your legs, you're not making the digestive enzymes you need. So you essentially have become a composter. And no one feels sexy if they feel like a composter, right? And so if we're just fermenting things, then inherently you're not going to feel good. The other thing when it comes to bowel issues that's not normal is having a bowel movement every couple of days. Like I have some of the most backed up patients I have ever witnessed in my whole life. And so we need to be having a bowel movement every single day. If you're not, it is an issue. And that's something to unpack. Then moving from your anus to your vagina, which is everyone's favorite thing. Again, we need to get into talking about yeast infections, also not normal, right? Any kind of discharge changes, all that kind of stuff is a sign that something is going on in our bodies. And I do not know why, as a society, there's so much discomfort and shame talking about these things because they're foundational aspects of health. But if you have constant infections, they can be treated and they can be fixed. And it's actually telling your practitioner a lot about your health. So it's such an important thing. And then joint aches and pains, right? So waking up in the morning feeling stiff and achy. Like I have so many patients who wake up and they're like, oh my God, I feel like I'm 80. I'm constantly stiff. I'm constantly uncomfortable. That to me is another very, very, very clear sign that we have issues going on in terms of that inflammation axis being affected. Then we look at mood changes without a clear trigger. So that is going back to the fact that inflammation is a huge piece of mood changes and mental health. So what we see happening now is that inflammation actually changes the way the communication of your brain occurs in a really significant way. So it's not just that we are seeing that gut bugs are directly changing inflammation and changing your brain. If anyone's interested in health, you would have seen so many of these studies come out lately. It's absolutely fascinating to see what's happening. But then too, we are also really starting to see that it's actually changing the way those hormones work. And so if you have a day where you feel absolutely amazing and everything's good and you're like, yes, I could run the world. And then you have a day where you don't want to get out of bed, we really need to look at that and break those things down. Okay. So then now we look at turning things around here, because that's the big thing. You're all here because you're like, hello, I feel it. I've got angry hormones. I want to get out of this cycle. And I think it's really important to, again, deeply understand physiology before we just kind of give you the solutions to these things. But from that standpoint, even more so, it's breaking down, okay, what are actionable things that we can do on a day-to-day basis to help to start to improve and affect change? Yeah,
sorry, can I just interrupt just for 1 second? Yeah. There's one person that does not have their mic on mute. We're getting a lot of extra noises. Would you please check your microphone to make sure it's on mute? Thank you. Go ahead. Sorry, Dr. Sarah Wilson.
Oh, no worries. Okay, perfect. So turning things around here, right? Like I said, this is the big thing we all want to know. So what do? We start with the foundations. Okay, so these foundations of health is a really, really big piece of starting to support health. And I always say, medical disclaimer, I'm a doctor, not your doctor. So make sure, I don't know what's going on with your personal blood work, with your personal medications, but we need to start to break these things down no matter what. And then you can always engage a healthcare practitioner if you're looking at trying other herbs or supplements, etc. But removing the stressors you can. So when we look at those big stressors, right, if we think back to that slide, we're looking at, okay, what's happening from an infection standpoint? What's happening from an inflammation and a gut standpoint? Nutrients are such an easy stressor to reduce. So that means going in and getting basic blood work done. I can't tell you the number of women who I say, okay, when was the last time you had blood work? And they're like, like 5 years ago, maybe, not really sure. We would never, ever conceive of running our businesses based on a feeling, right? Like we need data to drive our businesses. If you're trying to decide, oh, am I going to launch this or this? Am I going to hire this person or this person? You want to know exactly what that job description is. And you want to know exactly where the funds are coming and what's going to be the most profitable. So when I'm making decisions about health, I do it in the exact same way. I'm like, okay, what does the data say? Because if you're vitamin D, it's fine. And then I give you vitamin D. One, it could be harmful because you can have toxic levels of it. And two, you might not feel any different. So then that's an intervention that you spent time and energy and money on that had absolutely no bearing on your health. And the reality is most of us are vitamin D deficient. So that might have been a bad example, but there's a lot of these situations that testing makes the path so clear. And I think when you're feeling lost in your health, we forget that we can also ask for these biometrics. We can ask for what it means about us to have this information or to have this blood level off, right? Because again, when we look at the reference ranges there, they're looking at disease. I'm looking at health. So you may fall within a non-healthy category of your blood work, and we can work on that. It doesn't need to be flagged for that to be an issue. It's flagged when there's a disease. So go to your doctors, ask for that blood work panel. It can be so important if you're not feeling well as a starting point. And oftentimes they're not going to run a full assessment of everything, again, because they're looking for disease. So if they don't have a treatment for it, they can't do anything with it. So I do a lot of blood work in my practice. That's you either submit to insurance or pay for yourself, but it makes what I do so much more effective when I have that data. So that's a really big one. Another one is the blood sugar balance. Like I said, I feel like it's the foundation of the triangle, like the pyramid. It's so critical. But we need to stop the grazing. My goodness. Even when I was doing obesity and immunology research, we knew that this whole snacking epidemic was going to cause an obesity epidemic, and it's here. Right? And it's because we are cultured that you need 3 meals and 3 snacks because Kraft told you to do it, and they have the most amazing marketing team in the world. There is no reason that we should have to keep our blood sugar balanced ever, right? What we need to have is our body to be able to access fuel and store fuel. It's called metabolic flexibility, meaning when I eat a meal, it can store it away, and when I'm not eating, it can pull it out of storage, and everything's properly regulated. So that's a foundational aspect of health. But if you're not eating protein, fat, and vegetables at every meal, and you're just doing the whole carbitarian thing, then you're going to have issues with this, and you're going to feel like you need those snacks because your blood sugar can't regulate itself when it's like sugar, 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 sugar. So 3 meals a day, protein, fat, and vegetables at every single meal is, if you did that starting today, you would feel massively better within 2 to 3 days. It's so, so huge. And as women, for so long, we were told fat is bad for you. And so many people have stepped away from it, but fat is so foundational. Like our brains are made of fat, our hormones are made of fat. And so we actually need to step away from the carbohydrates, especially the older you get, the more carbohydrate intolerant you get. It's like Mother Nature's punishment. You're like, I have passed those years. I do not need to worry about these things. All I want to do is enjoy my food. And then now it's like, boom, boom, boom. You feel awful when you eat the carbs. But from that standpoint, it is really, really important. Then we look at finding your own personal inflammatory triggers, right? So is that, for example, randomly enough, as soon as I had my son, I could not eat eggs anymore. I felt awful when I ate eggs. That is a very clear personal inflammatory trigger for me, right? I also have celiac disease, so I obviously cannot eat gluten. But if you have more than 3 kind of food triggers that you eat and you don't feel good, then it's actually not about the food. All of these whole like elimination diets, don't get me wrong, they can be helpful to help you figure out what those triggers are. But if you have more than 3 foods that are affecting you, it's because you have a bacterial issue that needs to be fixed. It's not the food's fault. I always go back to that. The food did nothing to you. You know, it was just delicious. It just showed up. If your immune system does not know the difference between an infection and a food, it's an immune system issue that we need to get on top of. So really, it's a big piece of, okay, figuring out what those inflammatory triggers are. And if you can't, asking for help around that. And then this is honestly a huge one, recognizing your I'm finers, right? This is constantly what I always say, the fining behaviors. I'm fine. It's fine. Yeah, you're fine. Don't worry. It's fine. I'm like, we need to get over this. We need to acknowledge all the times in our day when someone says, oh, how are you? You're like, I'm fine. Even though deep down, you're not feeling great. And then just start to do that investigative work. What about that moment makes you feel less than good? Right? What about that is you saying like, I can tolerate this, but I don't feel good with this. Fine is not enough. And when we start to recognize all of the situations and times that we're like, it's fine, and instead ask for help, you really can advance so much in your life. And then I always say, look at your substance use. How many people, and you don't have to raise your hands, but just check in with yourself, are having coffee in the morning and we're having chocolate in the middle of the day to keep us up. Exactly. And then wine at night. We are using substances to change our body. We know that, for example, things like chocolate, Oreo cookies was the study that was done, interacts with your brain similar to cocaine. So just because it's okay to eat Oreo cookies in society and it's not okay to do crack cocaine, doesn't mean it changes your physiology any different. So if you're reaching for coffee in the morning and wine at night, it's because your body's screaming for help. And so that's substance use. And again, it's societally acceptable and it's not an issue unless you want to get on top of it. But from my standpoint, I always ask people that. I'm like, do you have your uppers and your downers during the day? And you just feel better about yourself because it's not cocaine and trazodone, right? So from that standpoint, we really have to look at those, because if you feel okay, but that's how you get through the day, then that's really a piece that we can change. And then embracing herbs. So there's so many great teas that are out there now that can be so helpful for calming that stress response. So we look at herbs like valerian. It smells like dirty socks. It is horrible, the smell, but it is amazing for the human body. Even those like Sleepy Time Tea Extra by Celestial Seasonings has valerian in it. It has passion flower. Those are amazing. Other herbs like lavender can be so helpful. That's why there's lavender in everything now, in your bath salts, in this, in that, because it calms that stress response. And then holy basil is an herb. It's called Tulsi or holy basil that is really nice for the nervous system, and it's more of that kind of adaptogen. So these herbs, like I said, you can have a cup of Sleepy Time tea. It doesn't actually put you to sleep. There's nothing in it. It just calms your nervous system. So you can have that throughout the day to calm your body down so that you can see things better, and that you can move through without needing that, okay, like wine, coffee situation. And don't get me wrong, like I'm on team coffee, but I love coffee. I don't use it as a drug. Right? There's a huge difference between enjoying 1 cup of coffee and having coffee like 4 or 5 times a day and being exhausted and being like, okay, where's my shots? Where's my shots? Where's my shots? So it's, and again, it's hugely used right now. It's not something I want you to beat yourself up about, but just recognize that. And then another herb that I absolutely love, I go to very, very frequently. It's called Eleutherococcus senticosus. So it's the worst name ever to say on a webinar. But if you Google Siberian ginseng, it's the same thing. That's an herb that I absolutely love for cognition and focus and attention. And it's just like such a nice balancing herb. So those are really big things that outside of correcting blood sugar, correcting inflammation, working on your gut bugs, testing your deficiencies, you can start today with just calming that like, ooh, I'm stressed nervous system response using some of these herbs. Okay, So now we'll wrap it up quickly, and then I can ask or you guys can ask any questions you have. But from my perspective, I think it's really important that as women, we recognize we do not have to choose between health and wealth and vitality. We can have a balance. I see it all the time. What I didn't put in my bio is that I used to practice in Toronto. And part of the reason why I left Toronto was not only to be closer to family and to raise my family in a smaller town, but also because I see people burning the candle at 20 ends there, and they don't even know how to ask for help because they're so busy. But when they do, I can't tell you how many C-suite people I had come in and deal with these issues and they feel so significantly better. I had women who would send their whole leadership teams to me because they're like, honestly, we can perform better. We can do better. So you don't have to choose between these things. You really can do it when you understand your individual bucket and what's filling it, when you understand your individual stress response and how it's being impacted. And then, like I said, a huge piece of it is just recognizing those vulnerability pieces. So am I most vulnerable to inflammation? Am I most vulnerable to blood sugar imbalance? Am I most vulnerable to hormone imbalance? And start with that, start asking questions about that. And that's just such a foundational piece. And I have a book, it's called Finally Lose It. So it's about health, but it talks about that weight loss resistance piece, but I break down a lot of these things in a lot more detail in that as well. But outside of that book, if you are in Ontario, unfortunately, we can't work with people outside of Ontario at the moment. But if you are in Ontario, I have a team of practitioners that I work with and that especially our other naturopathic doctor, train very, very closely to help women unpack all of these issues. So we are here if you guys need help, if you want to learn more about all of my nerdy journeys through the research and hormonal and inflammatory health, then I do post some of that, and I'm starting to post more again on Instagram. But other than that, if you wanted to get more support, then we're here to help.
Sarah, thank you so much. That was a lot of great information. And as business owners and as moms and wives and grandmothers or what we are, we're always giving so much more and we neglect ourselves. And you certainly pinpointed that very well on what we need to do to make ourselves better and healthy, and because we play such a big role in so many aspects of our lives, right? So yes, I really appreciate everything you said, and I'm sure Josie has a few words to say as well. Josie?
Honestly, Sarah, thank you. Thank you so much. You didn't only open my eyes for my own health, but for some of my family members. And I loved how you explained that, before you look at mental health, look at the physiological health first. It's not something that is always addressed when you see your doctor. Mm-hmm. And I think as women, we need to advocate more for our own health, our daughter's health, our family's health. So this, like you said, knowledge is power. And so I thank you very much for this. And hopefully we'll have some other future webinars or seminars that we can do with you as well. Because I think it's extremely important for women, and especially young women, as they're learning more about their health and bodies too, right? There's too much information out there and it's not always correct.
Yeah, and I can't tell you like how many women in their 30s and 40s have to explain what their period is.
Wow.
Which is why like I talk about it in details like this, and people are like, why are you talking about your poo on a webinar? And I'm like, because no one knows. You know what I mean? Like I'll explain to a woman that discharge in the middle of their cycle is normal, and they're like, stop the train. I've been treating a yeast infection every month for years. I'm like, right? So it's so important.
Yeah. Well, we're so glad that you're here in Kingston. That's wonderful. We're so pleased that you're here. Let me just see what kind of questions we have here. I know there's.
I pulled some up too. Yeah.
So you want to look at that, Sarah? And
I can address some of those. Absolutely.
Okay.
So
great.
There was a question about mucus in infant stool. So it depends on how old they are. Sometimes kids' bodies are adjusting to their new microbiome, but really over the age of 1 or so, it means they're reacting to something. So common and normal are very different things. I talk about that all the time. It's common to not feel good. It's not normal. And then there was a question, is there comprehensive blood work available for free to test nutrients. You can get a look from your medical doctor, like OHIP here does cover a lot of things. So they can do liver panel, lipid panel, something called a CBC, which is checking for anemia. They can do vitamin D, they can test your nutrients. It's a really good start. And then other than that, more sophisticated testing, oftentimes you do have to pay for. Heavy metals, not necessarily, yeah, there's not going to be a free test for that one. Thank you, it was great. Do I have a men's side as well to my practice? I always joke that I only treat men when I treat their partners, because otherwise they don't listen to me. Because women are affecting so much change in the home. So I treat a lot of men, yes, but it's because I treat their partners.
Wonderful.
And then another, thank you. Preventative pieces missing for sure.
Is it possible to have an inflammation-free body? Is Cheryl Circliffe has asked.
Yeah. Full stop. That's like the easiest answer today. Yes. Yes, it is. Question regarding PMDD. I think I have it and have no idea how to explain it to my GP. Great question. So from that standpoint, PMDD is essentially before your period comes, it can be up to 2 weeks of the month. You have really significant mood changes. So it affects everything. It affects mood, energy, it affects motivation, drive. It's a really, really significant impact. I actually work with a fair amount of entrepreneurs on this because 2 weeks of their month are productive and the other 2 weeks of the month, they can't achieve very much. And so just explaining your symptoms and telling your doctor that it happened 2 weeks before your period and you've tracked it is a really great way. Their main approach is going to be to give you an antidepressant, which take it if you have to, and that makes a big difference because some people have suicidal ideation. It can be really significant. So take it if you need it. But there's also a lot more that can be done on inflammation and gut bugs and on hormone balance with PMDD.
And here's another question. Is there a number to aim for in terms of adequate vitamin D levels? Is this individual, i.e. I need more vitamin D for my husband, for instance, so can you give us some answers on that?
Yeah, so on your in your bloodstream, you should have 100, and the Canadian units, it should be 150. And so your doctor will say if it's 75, it's okay. But all of the health research in terms of regulating inflammation and hormones shows it should be at 150. So if you get that run and it's less than 150, then you need to take more of your supplement. The absorption is going to be different. So your medical doctor will tell you to take 1,000 IUs. Sometimes people need to take 3 or 5 or more in order to get to that level. But that's going to be personal, but 150 is the number you're looking for.
And you were talking about B12 as well, Sarah. Tell me a little bit more about B12 as well.
Yeah, so B12, the research shows when you measure B12 that I look oftentimes to fertility research because we always want to be healthy enough to carry a human, right? So anywhere between kind of 500 and 800 is where we want to see B12. And B12 regulates energy, it regulates mood, focus, attention. There's so many pieces from a B12 perspective that it plays into.
Okay, super.
Difference between caffeine, alcohol, to regulate your mood, body, and using herbs. It's a great question. So you can use herbs as uppers and downers. You absolutely can. A lot of practitioners use herbs as uppers and downers. From my perspective, it's a Band-Aid approach, which works for a short period of time. But if you don't address everything else, then you're definitely not going to get the full benefit. So what it can do is sometimes break the cycle. If you're constantly firing off in fight or flight and you calm that response, then you can help to see things from a better perspective and you can help to lower inflammation. So sometimes you can use it to break the cycle, but you have to be very careful that you're not using herbs like drugs because you can definitely
about that balance, right? Finding that balance, correct? So
exactly.
So if someone wanted to come to see you, so tell me your system, how that works. If I was to come to see you, what would you ask? I'm just curious at this point.
Yeah, absolutely. So if you, like I said, unfortunately, I can only treat people in Ontario, but we do have an Ontario-wide practice. But when you come in, I have really thorough intake forms. I always warn people because I want to see your whole health. on a piece of paper. I want to see everything about you and really come to understand what that looks like. And then we meet, and my first visit's an hour, and we go through the details of everything in your body. Because from my perspective, when you understand how everything in your body is connected, we can affect change. I look at your blood work that you've had done in the past, and then I'm recommending additional blood work to customize your protocols. And then I always do use an herb, like a mix of herbs, things to correct all of these areas that we've talked about, nutrients, gut microbiome imbalances, etc. And oftentimes I am customizing your like meal structure, so how you would eat, to your blood work. So knowing exactly how many carbohydrates your body can handle is something that's really important and really helpful. So those are the pieces that we unpack. I like to emphasize, I do work really closely with my team, because unfortunately I currently am booking into the middle to end of April, depending on when this recording goes out. But I do have a team of people around me who are amazing, and you can also work with them as well.
And how big is your team, Sarah? How many?
Yeah.
Like,
we have a naturopathic doctor, we have counselors that work with us, we have yoga therapy, and then I have a pretty big team of administrative support, business developers, all that kind of thing, because I also have a business where I train naturopathic doctors. So that's
wow.
Yeah,
you're a busy gal.
I am, but I love what I do, so it doesn't feel
well,
hard.
That certainly comes through in a big way. So thank you so much for your time. I know you're a very busy lady, and as I said, we're so glad that you're here in Kingston, and I'm sure you'll be getting some calls or emails and so forth. So, and as I said, this is all recorded, and it will be on our YouTube channel for Women Mean Business.
And then we also have a health spotlight in the newsletter. So if you guys want more tips and tricks like this, then I record, me and other people on my team also record videos that go out there. So you can get little snippets when you read the newsletter as well.
Well, it was very informative, and thank you so much. Josie, do you have some announcements? And so do I. So why don't you go first?
Thanks, Gabby. I also want to let everybody know that we'll be sending you a link to the video, so you can find it on YouTube, and we'll send you a link to Dr. Sarah's book as well. So if you want to get more information. But I also want to let you know that we have 2 other presentations that are coming up very soon. One of them on February 23rd from 7 p.m. to 8 p.m. This is in collaboration with the Limestone District School Board. It's a salute to women in trades. And for those of you who may have met Jen Baran, maybe about 2 years ago, I think, Gabby.
Yes, it was.
People loved her, and she's also a very dynamic young lady, talking about her journey as a plumber and in the trades. And I believe she now is with the UA Local 401 Plumbers, Steam Fitters area here in Kingston. So she has quite an interesting story. And if you want to tune in, you can find more information about this, by the way, on our website on the homepage, www.womenmeanbusiness.ca. The other one that's coming up in March, we're excited to see, is by author Laura Southall, and she's going to be talking about building your wealth resilience, rental properties for women, and what that's all about. So also another dynamic speaker. So please do go to our website to learn more, to register. You can also learn more if you subscribe to our free newsletter, which comes out every 2 weeks. And by the way, it includes Dr. Sarah's information on the subject of women's health. So please do tune in to that. And again, you just go to our website and you can sign up for free. So thank you, Sarah.